1 in every 1,000 American kids is diagnosed with juvenile idiopathic arthritis, or JIA. It's a disease where the immune system attacks the joints instead of attacking bacteria and viruses. It can be tough to diagnose and as a result go undetected while destroying a young person's joints. Here's what parents need to know. High school sophomore Amber was a competitive gymnast until 2 years ago. Now, the girl who loved to tumble across a mat has trouble walking across the floor.
It seemed like a lot of things were hurting, and I kept going to doctors, and they kept diagnosing it as like sprains because nothing was showing up in the x-rays.
Finally, an orthopedic specialist referred Amber for blood work.
When we got the result for that, her rheumatoid factor came back at 102. It's supposed to be like 14.
What's going on?
Well, my hands hurt and like my knees.
Dr. Ginger Jano says parents and patients overlook symptoms because some kids with JIA don't feel joint pain. She advises parents to look for other signs.
A limp on a daily basis, or swelling, or subtle things where you notice that they're using a different hand for something.
Dr. Jano says patients need to get a diagnosis as soon as possible so they can start treatment.
The inflammation, if left unchecked, it is sort of like a house on fire, and if you don't put out the fire, it burns down the structure.
Amber says the monthly infusion of the drug Actemra did not work, but she's hopeful the pill form of Xeljanz will. Weekly injections of 2 other medications have not.
You just need to keep pushing through, and you will get through it.
Researchers still aren't sure why kids develop JIA. Genetic and environmental factors do play a role. JIA used to be referred to as juvenile rheumatoid arthritis, but doctors have moved away from that name. And that's your Health Watch. I'm Connie Fellman, Local 3 News.